name is Lawani. I am the new program director, statewide program director for the ME-MSN program covering Hilltop and Orange County. I got my undergrad from Sac State in healthcare administration. Um, and while I was getting my undergrad, I ventured into tax and accounting. So I have a tiny business background, tax and accounting background, um, and I think it was just for the love of learning. Whatever I can learn, I was willing to learn because over time I've learned that life is a full cycle and it comes back, and I always use the knowledge one way or another. So um, went through that while I was in the middle of getting my undergrad at Sac State. I had gone through community college, transferred, and we lost my older brother to Takotsubo cardiomyopathy. I remember my mom coming back from Germany and um, grieving through the loss of her child. And through her grieving process, she would always talk about the nurses who cared for him. And I thought, oh God, I've never seen my mom so devastated. So, both my parents actually, I've never seen them so devastated and so um, human in their vulnerability, because these are my heroes, right? They're my parents. Um, but in their devastation and in the vulnerability, she remembered the nurses. And I thought, oh gosh, I want someone to remember me like that. I want to be the good that someone is able to remember when they've had such a massive loss. And that's how nursing started for me. And how do I use my prior leadership experiences, both in tax and business, and how do I culminate all of those experiences and move forward? And so I ventured into a CNL program, and it was at the University of San Diego. Fun fact, Dean Eileen interviewed me. Going through the program, of course, all of my prior experiences, healthcare administration, everything was being put into use. I was the graduate nursing student president, and so it entailed a lot of collaboration with faculty, collaboration with the school, with other departments. Dean Freibauers was my health policy faculty, and finished the program. Uh, and there came Dr. Roth. So Dr. Roth was the then director of the PhD program. And during my time as president of the Graduate Nursing Student Association, we had the earthquake in Puerto Rico. And there was a sister school there, a school of nursing, that was collapsed. So we fundraised, got supplies, and turned back the next year I was graduating, and Dr. Roth said, oh, what do you think about being in the PhD program? And I thought, lady, let me finish one first before I get on to another. But my dad always said, if people believe you're able to do something, you ought to believe in yourself. So I said, okay. I remember taking my NCLEX. I had taken my NCLEX on a Thursday. And so I had to wait until Monday to get my result. And I had a weekend that was full of anxiety and diarrhea and everything in between, just waiting for those results. And Dr. Roth had taken me to lunch and said, oh, just it'll be okay. I just want to circle back about the PhD program. And I thought, okay. Now, one, I don't even know if I passed the NCLEX yet. And this lady is here talking about the PhD program. Well, okay. If she thinks I can do it, then I bet I could do it. So I applied for the PhD program, passed my NCLEX, applied for the PhD program, and Dean Fry Bowers was again my health policy faculty, was one of my mentors through the doctorate program. Uh, it was really great having that experience, going through that experience, and then through it, I started teaching at USD. And then everything in between happened. It feels like I blinked and now I'm here. So it's been a full circle. Um, and I think what I've learned from that is you just never know. Nursing is such a small world. You never know where you're going to meet people. You never know how, what impact you're going to have on people. But each day you can, you know, be impactful. Each day you can present your most authentic self. Each day you can put a smile on someone's face. Each day you can call people to higher standards. Each day you can be of help. Each day you can be empathetic. Each day you can be compassionate. And each day you can treat people the way you want to be treated. Areas of research, my specialty with research would be palliative care, hospice, end-of-life care, and everything in between on that spectrum. It's a growing niche in nursing that's very underutilized, and my goal is to, one, help further research by developing new knowledge in that area, but also help students understand what palliative care and hospice and everything within that spectrum is about, so that we can start to fill in the gap. And so my goal will be to ensure that, again, these are things that we don't find in the text, to ensure that those gaps are being filled for our students, so that they're better prepared when they get out in the community to not just be nurses, but to be graduate nurses, to be CNLs, to be leaders who are visionaries and able to take our healthcare system to the next level. Mm-hmm. I also want to produce nurses who I will allow take care of me, right? And nurses who I would be very, very confident if they were to care for my siblings or for my parents. And if we can achieve that, then I would have fulfilled my purpose. That'll be my goal for in my current role as PD, but also as a nurse and as a researcher. So putting it all together. Clinical nurse leader, I think, is at the center with the patient, saying, okay, this is what you need, and this is how we're going to help bridge whatever gaps exist to meet your need, whatever it may be, physical, psychosocial, mental, spiritual. But we also, engage with quality improvements, mitigating errors in the care that we give, and ensuring that our patient health outcomes are always front and center. So it's a leadership pathway. If we can fully utilize the CNL in the role that it was created for, it makes our healthcare system better, actually. So I really hope that my students turn out to be much, much better than me. And I think I've done a fantastic job, but I hope that they do a way better job than I can even fathom or imagine for themselves, but also to honor the legacy that we leave behind.